So you have a patient by the name of Jane that has seen you for something. So let's let you introduce her.
Jane's here with us today. She had been suffering with something called Interstitial Cystitis, also known as IC, which causes a range of symptoms from pelvic pain, pain with intercourse, having to go to the bathroom frequently and urgently. It really decreases people's quality of life in a lot of different ways. Sometimes it's just pain, not just, but pain and sleep interruption, to problems with sexual intimacy because of the pain from that, and overall decrease in quality of life. And so a lot of people think that they have a urinary tract infection, and a lot of times will go in, be treated for a urinary tract infection, even when the cultures are negative. When they're finally diagnosed with IC or interstitial cystitis, they'll do a wide variety of things, from antihistamines to medications to anti-inflammatories. And then a lot of times they'll say, hey, change dietary things and see if that makes a difference. And for many people, that's very helpful. But there's a lot of people who still go on to have a lot of problems. Some people will get their bladder distended. It's a real serious problem for women, and so many millions of women have this. And so when Jane came, this was something that she had the O-Shot done, and I want you to kind of hear her story about what happened from symptoms to what happened after the procedure.
Well, I had all the symptoms that Dr. Boyd spoke of: the pressure, the urgency, couldn't sleep at night, getting up to go to the bathroom. I've had the bladder distensions. I've had the ulcers burned off my bladder, the pain during intercourse, the frequent bladder. But after, it was on the drive home after having that shot, my life has changed. The pressure's not there. The painful's not there. I can sleep through the night now without having to get up dozens of times to go to the bathroom. So it has been a game changer as far as what it has done for me. And it beats taking medication every day.
If there's one thing that you can do, try the other things. Like for a lot of people that works. And so she's tried all these things, even going as far as a bladder distension. So that's where they put something in your bladder and let it sit there.
I had that twice.
Yeah, twice. And that is not a comfortable procedure. I will just tell you that is very uncomfortable, to stick a tube into your bladder and put medicine in there. She has gone above and beyond what she has dealt with due to this.
All right, I have a question, and I'm just kind of trying to get a visual of the age. Jane, can you tell me how old you are?
I'll be 53 in December.
Dr. Boyd, is this something that is specific to some of us that are over 50, or is this kind of something that happens with different females in different age groups?
All different age groups. You can see women in their 20s to, women in their 70s and 80s. So it's not a menopausal problem, as, you kind of go, well, she's in her 50s. No, not at all. All age groups of women are affected by this. And it can be really a huge quality of life issue. As you said, you imagine you have to go to the bathroom all the time. You have spasms when you do try to go. You eliminate just a little bit. It's really frustrating. And then, you can imagine even intercourse for a lot of women, who already have a super irritated bladder. It's just super uncomfortable, and it's just not, it affects a lot of different areas of a woman's life.
If they've had symptoms like this and they've tried other methods, can they just get a consultation with you about what they think might be going on?
Absolutely. We do a consultation just for 15 minutes to kind of talk about what they've done and to see if they would be a good candidate for it. They come in, after the consultation, they would come in another day, and they get the procedure done. It only takes an hour from start to finish, from the time you get in to the time you're gone. And the actual procedure itself probably takes no more than 5 minutes.
And of course, this is it painful?
All right, I'll let you answer that one.
No, the numbing cream, it's not, you can feel it, but it's not, it's nothing compared to having your bladder distended. So it's over in just a brief few minutes.
And for me, I actually had the O-Shot done for incontinence after having children. It just got to the point where there's a lot of things that I wasn't doing because of it. So I've had it done as well. I've had it done twice just because I went to 2 training classes. And 2 weeks after I had the procedure done, my incontinence was gone.
Well, see, and I don't have that problem anymore. Do you go from feeling like you needed the pins to not needing one?
And is this something that you do just like one time and you're done forever, or is this something you have to have done like, once a year?
That's a great question. Everybody's a little bit different. How much collagen you have, your age certainly does play into whether or not you're taking hormones, but most people will last for at least a year after they have the procedure done. I mean, she may never go on to have any other problems with it, and that would be such a blessing. But every once in a while, you'll have somebody come in and say, hey, I need to touch up. And, it's been a year for me, and even I'm like, okay, it's about time for a touch-up for me. And that's just, I can just tell just a little bit, but it's not anywhere near what it used to be.
Maybe if anybody has any of these symptoms, and maybe a lot of people do and they just don't talk about it.
A lot more people have this problem, and they never talk about it because it's embarrassing, it's an irritation, and it's just, Jane's too young to have this problem. I mean, this is, she's way too young. She just looks super young. She just looks great, and you would never guess that she was 50 years old. And so it just seems like an odd thing to have to deal with as such a young person, having to wear Depends. I mean, I'm not saying she's wearing Depends, but talking about like having to wear a panty liner or even be worried about something that she shouldn't have to be worried about.
All right. Well, we're going to send everybody that's listening to forwardhealthsolutions.com. Let them look this up on the O-Shot. And then, Jane, thank you so much for being on with us. And thank you, Dr. Boyd, for answering all of our questions and explaining this, because I know that it's hard to not do it in technical terms.
Absolutely.